All right, welcome to the Functional Medicine Show. We have Dr. Lauren Castle with us today from the Functional Medicine Pharmacist Alliance and our PH Ally. I'm Sean, I'm your host, and today we are going to be talking about the PLMI, Personalized Lifestyle Medicine Institute. Lauren was at a event this last weekend, and she's going to give us a recap on that right after this wheel. All right, Lauren, I like this topic because I know nothing about it. So I'm going to kick it over to you right away and say, okay, tell us about this PLMI.
You got it. So Personalized Lifestyle Medicine Institute is an organization that was started by Dr. Jeffrey Bland. So if you're familiar with functional medicine at all, you probably have heard his name. He is someone who really pioneered the field of functional medicine. A lot of people call him like the grandfather of functional medicine. He started IFM back in the 90s, Institute for Functional Medicine, and now has this other organization that's really focused on exactly what it sounds like, right? Personalized medicine, specifically lifestyle approach. And so this was actually my first time at this particular event, and it was incredible. The cool thing about it is that it was a very interdisciplinary type of conference. So first thing when I got there and I sat down with my super healthy breakfast, they have amazing food, by the way, sat down at a table and started introducing ourselves. And I'm sitting there with a dietitian, a psychiatrist, a health coach, a PA, a nurse practitioner, right? Like literally every time I sat down at a table for a meal, everyone had a different profession. So it was really cool to be in that type of space. And it was really cool to be like the pharmacist, right? Representing the profession. And the cool thing, there was two other pharmacists that I met there from Hoya Apothecaries. So there was a very small population of pharmacists that were present at this conference, as is so often the case whenever we get outside of our pharmacy bubble and actually into these bigger spaces and start talking about the role of the pharmacist.
I love it. I love that approach. I love really you representing us pharmacists, and hopefully, in a couple of years that there'll be a lot more of us at that event with you, exactly. Representing our profession. Because I love, that's one thing we've always struggled with is working as the team with all these other different professionals and all these, different, anyways. So, and we struggle there. We really struggle there, and we always feel like we're trying to fight to sit at the table. But it's not. I don't think we need to fight to sit at the table. It's like just showing up, showing what we can bring, and I think it'll speak volumes when people get to know us and get to say okay, we don't want people on medications. The majority of us, right? We don't most pharmacists I know don't want people on all these medications. We want to de-prescribe. We want to teach you about lifestyle adjustments you can make, but we don't have the tools.
Exactly. Yeah. You nailed it. And, it was so interesting because like you said, showing up is truly the first step. And sometimes you go into these spaces not really knowing what to expect. But more often than not, I find anytime I introduce myself and I say I'm a pharmacist, people are so fascinated. They're intrigued. They're like, tell me more. Like, what do you do as a pharmacist, in this functional medicine space? Like, how or why would you even want to be involved in this? Like, don't you just dispense drugs? And, I had the pleasure and honor of actually getting to sit literally at the dinner table with some of the speakers and people that were putting on this event, again, like world-renowned experts. And they had no idea what pharmacists really are capable of as part of the healthcare team. And so on the one hand, it is such an honor to be able to help educate them. But on the other hand, my goodness, we have a lot of work to do to continue positioning the profession into this new space that we all know we're capable of. I've had some really amazing calls, even this morning, with other functional pharmacists. Shout out to Lara and Melody, having the same conversation, right? That right now, when pharmacists are stepping into these functional medicine conferences or trainings or events, which go back and watch our past couple of episodes, we've got lots of them coming up. There's this challenge that we have in front of us of, okay, so we're here and now we're trying to educate and explain and advocate for our role. How do we actually prove our worth though, right? So that kind of becomes the next step and the next challenge. And that's really where it looks like practicing at the top of your license, right? Like actually using that knowledge that you worked so hard to learn over the years and applying it in these functional medicine spaces. Yeah, that looks like deep prescribing, medication management, nutrient depletions, all the things, right? And pharmacists are out there doing this work every day. We just need to get really loud about it.
Yes. Question on that, because we love data as pharmacists, right? I mean, we love our guidelines. We love everything proved through the data. And getting to how do pharmacists prove their value? Like, what's your recommendation for other pharmacists in this role in your space, really to capture that data, to harness that, to maybe use it collectively as a group to be able to push that forward for us?
Yeah, I think that's a great question. And, in an ideal world, we'd be able to put together some clinical trials and studies around the role of a pharmacist, and actually quantify those different interventions that we're having. And so for some of our brilliant colleagues that are out there, particularly in academia, I think that there's absolutely a space and, an opportunity there for pharmacists who have that skill set to reach out to me, right? Like, let's partner together, let's work together and figure out ways to publish this type of information. We've done a couple of different, publications in like the American, oh goodness, I'm going to forget the name of it. It was AJHP. And that was way back when, right? Like very much just an editorial piece. Right. But even just getting the conversation started in more of these academic spheres can be a good starting point. But then even outside of, more of these like polished and professional formats, even just your own anecdotal evidence, your own stories can be extremely powerful. And, with anyone who is starting in this space or starting a new business venture or a new practice or a new service, and you're introducing these models, the data is absolutely important, right? And so that can be measured in a number of different ways. In functional medicine, we really use tools like the MSQ, which looks at the symptoms that the patient's experiencing and sort of gives them a score, right? And so then you can have the patient take that at the beginning, take it at the end, compare and contrast how much they've improved. And if you collect that data and kind of systematize it as part of your process, you can start to aggregate it and really see, like, yes, even as a pharmacist, my interventions are doing this much to improve our patients' outcomes. And then you can start to tie it back to like, okay, well, what were those interventions that you specifically implemented?
Okay, that was good. And also, so I'm thinking, it's so hard for us because it's like we're trained. Just we have our blinders on. We need this data. Maybe on the flip side, I like how you brought up the anecdotal evidence, because not everybody thinks like us, right? Not everybody needs all this data. They only need some great stories to really buy in and know that pharmacists are part of the team, right? So that's also like on the flip side, because when you're speaking to a health coach or when you're speaking to a dietitian, they're probably not going to be as nitty gritty about the collective data. They want your anecdotal data. They want to see your stories. They want to see the impacts you made, the use case scenarios, things like that. So, okay, that's great, Lauren. I'm sorry, I'm kind of getting us sidetracked from the event as far as the institute here, because I'm really fascinated with this particular one, because how can pharmacists get involved here and to really sharpen their skills for personal lifestyles?
Yeah. So, this event was, like I said, really amazing to be at in person. And certainly FMPHA is going to be working with PLMI to bring lots more pharmacists to this event next year. But if you want kind of a sneak peek or a very similar type of program or training, there's actually a pharmacy specific symposium that is happening in September that I think is worth mentioning. Some of the speakers are actually the same. A lot of the topic is somewhat similar, but again, through the pharmacist lens. So if you are newer to the functional medicine space, this can be a great one to go to and actually learn what your role can be in the functional medicine care team. So the one in the fall is the functional pharmacy symposium. And we can drop a link to that in all the show notes everywhere. But FMPHA members, of course, save $200 off the ticket price for that one as well. So our RPH Ally colleagues can get that as well whenever you join through our channel. But the content in this particular meeting, it was really fascinating because a lot of times, sometimes we go to these functional medicine conferences, they actually don't talk about medications all that much. There is such a focus on supplements and, lifestyle and diet, nutrition, those kinds of things, which as there should be, that's the foundation. But we also know that there's a lot of our patients who are on medications and that maybe can't afford supplements and tools, but metformin is going to be covered for their insurance, right? And so a couple of the speakers did a beautiful job at really kind of highlighting all the different modalities out there, right? Including medications. There was one speaker in particular that I really enjoyed, Dr. Twyman, who talked about something called the glycocalyx. So if you think about our blood vessels, right, and we have so much focus on the endothelium, right, and knowing that when that gets damaged, that's where the plaques can start to form. Well, even before the endothelium starts to be damaged, there's actually a whole nother layer of sort of these fuzzy little hair-like receptors that are on there called the glycocalyx. And so he did an entire presentation about this and all the different ways that we can support the physiology of that extra layer that doesn't really get a lot of attention. And some of those treatment interventions actually were medications. So it was an awesome presentation, especially if you're in hospital pharmacy, critical care, acute care, dealing with cardiac patients, ambulatory care, running Coumadin clinics, like so many applications that I just kept thinking about, even like critical care ICU. He talked about like fluid overload and like resuscitation and all these things. And I was just like, ooh, I'm getting flashbacks from like my hospital rotations right now. And it was just an area that I don't feel like it's talked about very much in this space. So it was very cool to hear about. And actually, I can drop those in the show notes as well, but he's got a whole recap up on his Instagram. So that's just like one of the many presentations that happened this weekend.
That's fascinating. You triggered me when you started talking about hospital rotations. It's more like nightmares for me. No, that's fascinating because I've never heard of that before. That we weren't taught that in pharmacy school. First time I've ever heard that term was right now today. So I'd love more information on that in your channel at RPH Ally. So that's fascinating, Lauren. That's awesome. That's awesome stuff. Anything else you wanna drop on us before we take off or until next week?
I would just say tune into the channel at RPH Ally. We'll share lots of resources there to kind of keep you guys up to speed on all of these upcoming events, ways that you can start to get involved, resources that you can share with your colleagues. Because again, it really all starts with each individual person sharing their stories, sharing their passion, and educating our colleagues so that we can all come together as a team and change patient care for the better.
I love it. And I also love that you mentioned the academia piece because it's like those are like our colleagues inside that can help us with the data, with helping showcase pharmacists in this role. So that was great. Awesome, Lauren. It's always a pleasure. We will see you next week, same time, same channel.